Hi friends, once again welcome back to my channel Mugambika Nursing. Friends, we are discussing important and previous year questions for nursing officer exam. Already special MCQ 10 parts we completed. If you are watching first time, kindly go through my previous videos. These questions will be useful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle. Also subscribe my channel and support me. Let's see today's question. Our first question. Newborn maturity rating is assessed by which scale? Options. Option A, New Ballard scale. Option B, Glasgow-Coma scale. Option C, Apgar score. Option D, growth chart. Newborn maturity rating is assessed by using New Ballard scale. Option A is the correct answer. This New Ballard scale is used to assess the maturity or the gestational age, especially in case of premature infants. Here, newborn maturity rating is assessed by using New Ballard scale. Option A is the correct answer. Move on to the next question. A removal of non-viable tissue from an open wound to promote healing is known as. Options. Option A, debridement. Option B, excision. Option C, cleansing. Option D, dressing. And the correct answer is debridement. Debridement means a removal of non-viable tissue from an open wound. It is mainly to promote healing. And the next question is position used while inserting NG tubes. Options. Option A, supine position. Option B, low Fowler's position. Option C, high Fowler's position. Option D, orthopneic. NG tube means nasogastric tube and the position is high Fowler's position. Option C is the correct answer. And the next question is, in midday meal program, the meal served should supply at least how much of total energy requirement? Options. Option A, 1/3. Option B, 1/4. Option C, 1/6. Option D, 3/4. Midday meal program was started in 1961. Midday meal program or school lunch program. In this, they are providing meals to the children and this meal should supply at least 1/3 of their total energy requirement. So here the correct answer is 1/3. Option A. This question is their energy requirement. Suppose if calories means calories also 1/3. The requirement of calories is 1/3 and protein means 1/2 or half protein. Okay. And the next question is, in case of dog bite, the biting dog should be observed for at least. Options. Option A, 5 days. Option B, 10 days. Option C, 15 days. Option D, 3 weeks. In case of dog bite, the biting dog should be observed for 10 days. Here the correct answer is option B. In case the dog is showing any signs and symptoms of rabies or if the dog is dead means we should immediately take the medical care. Before that we have to take vaccine and all, but we have to observe the dog for minimum 10 days. Option B is the correct answer. And the next question is, the WHO initiative A Right to Sight is named as. Our options. Option A, Vision 2015. Option B, Vision 2020. Option C, Vision 2030. Option D, Vision 2025. The Right to Sight program is mainly aims to prevent the blindness. The WHO take the initiative A Right to Sight. This is also known as Vision 2020. The main aim is to prevent the blindness and also to prevent the eye related problems. Okay. And the next question is, which vitamin is also known as anti-sterility vitamin? Options. Option A, vitamin C. Option B, vitamin K. Option C, vitamin E. Option D, vitamin A. And the correct answer is anti-sterility vitamin is vitamin E. Option C is the correct answer. Move on to the next question. Miotics are drugs which cause. Options. Option A, constrict the pupil of the eye. Option B, constrict the blood vessels. Option C, dilate the blood vessels. Option D, dilate the pupil of the eye. Question is, miotics, the use of miotics drug is which helps to constrict the pupil of the eye. Option A is the correct answer. Mydriatrics are the drugs which helps to dilate the pupil of the eye. Okay, so miotics and mydriatrics. Mydriatrics for dilation, miotics for constriction. And the next question is Galactoc is the drug which cause options. Option A increase breast milk secretion, option B increase blood glucose level, option C decrease blood glucose level, option D increase appetite. Galactocs are the drugs which helps to increase the breast milk secretion. Option A is the correct answer. And the next question is hypnotics are the drugs which cause options. Option A relieve anxiety, option B induce sleep, option C reduce muscle tone and cause muscle relaxation, option D all of this. Hypnotics are the drugs which is mainly induce the sleep. Okay, option B is the correct answer. And the next question is the nurse reviews a client electrolyte result and note that the potassium level is 5.4 milliequivalent per liter. What should the nurse look for on the cardiac monitor as a result of this laboratory value? Are options. Option A ST elevation, option B peaked P wave, option C prominent U wave, option D narrow peaked T wave. Here the question is the nurse reviews the client laboratory report. In that serum potassium level is 5.4 milliequivalent per liter. Serum potassium is elevated. Normal serum potassium is 3.5 to 5.1 milliequivalent per liter. So here patient value is 5.4 milliequivalent per liter. That is, it is elevated. Elevated means the patient is having hyperkalemia. On the basis of this laboratory value, the nurse look on the cardiac monitor. Which ECG changes can not in the cardiac monitor? That is our question. So in case of hyperkalemia, we can see tall peaked T wave. Okay, so that is there in our option, and we can note flat P wave and widened QRS complex and prolonged PR interval. Okay, this we can see in case of hyperkalemia. So our correct answer is option D, narrow peaked T wave. Okay. Move on to the next question. Ptosis is the result from trauma in options. Option A cranial nerve third, option B cranial nerve second, option C cranial nerve fourth, option D cranial nerve fifth. Ptosis means drooping of the eyelid. It is due to the injury or trauma to cranial nerve 3. Cranial nerve 3 oculomotor nerve. Move on to the next question. Surfactant production start at the age of options. Option A 20th week, option B 28th week, option C 32 weeks, option D 36 weeks. The surfactant which is present in the lungs which will help for easy breathing. So its production will start at 28th week of gestation. Option B is the correct answer. And the next question is intra-articular route of drug administration. Injections are given into options. Option A arteries, option B joints, option C atria, option D areolar tissue. Intra-articular means within the joints or inside the joints. So the injections are giving into the joints. Option B is the correct answer. Move on to the next question. The intraocular pressure is measured by using options. Option A tonometer, option B Stennett chart, option C ophthalmoscope, option D endoscopy. Intraocular pressure is measured by using tonometer. Option A is the correct answer. Normal IOP is 10 to 21 mm of Hg. And second option Snellen chart. It is mainly used to assess the visual acuity. And option C ophthalmoscope. It is useful for the visualization of the fundus of the eye. Okay. And endoscopy is used to visualize the inside the body parts. Okay. Move on to the next question. Short shuffling gait is characteristically seen in options. Option A Alzheimer's disease, option B Parkinson's disease, option C multiple sclerosis, option D myasthenia gravis. Here our question is short shuffling gait or shuffling steps or stooped position and propulsive gait are the characteristic feature of Parkinson's disease. Option B is the correct answer. Move on to the next question. RRB is caused by a virus is called options. Option A paramyxovirus, option B Lysa virus type 1, option C myxovirus, option D adenovirus. RRB is caused by Lysa virus type 1. Option B is the correct answer. First option paramyxovirus which cause measles, and option C myxovirus which cause mumps, and option D adenovirus which cause some respiratory infection. Our question is rabies is caused by? It is Lysa virus. And the next question is, persistent diarrhea in infant means diarrhea lasts for options. Option A 7 days, option B 14 days, option C 21 days, option D 1 month. Persistent or recurrent diarrhea means the diarrhea which lasts for 14 days. Option B is the correct answer. And the next question is, the drug of choice in the treatment of HIV infection is options. Option A nevirapine, option B zidovudine, option C Venavir, option D tenofovir. Drug of choice for the treatment of HIV infection is zidovudine. Option B is the correct answer. And the next question is, drug of choice in pregnant woman with HIV infection to prevent its transmission in fetus is options. Option A lamivudine, option B tenofovir, option C nevirapine, option D squenavir. Drug of choice in the treatment of HIV infection is zidovudine. Here, drug of choice in pregnant woman with the HIV infection and to prevent its transmission to fetus is nevirapine. Option C is the correct answer. Move on to the next question. Which of the following anti-cancer drug is cardiotoxic? Options. Option A adriamycin, option B mitomycin, option C cisplatin, option D cyclophosphamide. Anti-cancerous drug which is cardiotoxic is adriamycin. Option A is the correct answer. This adriamycin is contraindicated in case of severe myocardial insufficiency and myocardial infarction. So this is cardiotoxic. And the next question is, drug of choice in breast carcinoma is options. Option A methotrexate, option B chlorambucil, option C tamoxifen citrate, option D cotrimoxazole. And the correct answer is, it is tamoxifen citrate. Option C is the correct answer. Drug of choice in breast cancer. And the next question is, drug of choice in choriocarcinoma is options. Option A tamoxifen citrate, option B methotrexate, option C acyclovir, option D sulfan. And the correct answer is, it is option B methotrexate. Choriocarcinoma means it's a malignant tumor of trophoblastic cells. Okay, it's a fast growing malignant tumor. Okay, its drug of choice is methotrexate. Move on to the next question is, ototoxicity and nephrotoxicity are the most common adverse effect of which group of drugs? Options. Option A tetracycline, option B cephalosporins, option C aminoglycosides, option D fluoroquinolones. Here our question is, ototoxicity and nephrotoxicity is seen in which group of drug? Okay, we can see the side effect of aminoglycosides. It include ototoxicity, confusion, disorientation, renal toxicity. Renal toxicity is nephrotoxicity. Okay, so ototoxicity and renal nephrotoxicity is the side effect of aminoglycoside, and other side effect include gastrointestinal irritation, palpitation, blood pressure changes, hypersensitivity reaction are the side effect of aminoglycoside. So here our correct answer is option C aminoglycosides. So far we discussed important and previous year questions. If it is useful for your studies, please share my videos to your friend circle.